Now a studio debate on health policy. We invited Labor's just appointed Shadow Health Minister Walt Secord MLC to debate health this week, but he declined. A short time ago I was joined by Greens Health spokesman Dr John Kaye MLC and the Minister for Health, Jillian Skinner. Welcome to you both. Minister, under the agreed rules of engagement, you're defending the government's record, so I invite you to make a brief opening statement.
We have invested record amounts into the development of our hospitals, $5 billion over this year, a 4-year period. Hospitals that have been promised but never delivered right across the state. We've invested in extra staff, doctors, nurses, our support workers and others in the clinical sphere. We've improved performance, so we've got better outcomes in terms of emergency patients, elective surgery patients, more patients than ever before, and a record health budget. All up about $20 billion this year, some of it's capital, but over nearly $19 billion in recurrent funding, which is a 5.2% increase on last year and 20% increase over the 4-year period. So in a nutshell, I'd say better health care, more treatment for patients, more timely treatment for patients, much happier staff, morale has gone up, and infrastructure that's going through the roof.
John Kaye?
Politicians always take credit for the quality of our public health system, and we do have a world-leading public health system. But the reason for that is because of our nurses and our doctors, our clinicians. And if we are to look to a future for our public health system, it has to start by talking about specifically nurses and doctors and other clinicians. Our key concern for the next 4 years will be to make sure that we have a workforce that grows in proportion to the demand, that is focused on the needs of communities and is freed from commercial pressures. We have grave concerns about, as we'll say, about the growth of the Americanisation, the privatisation. As the nurses, and I actually agree with the nurses on this.
We'll get into that.
But we do have key concerns also about where we're spending our health budget. We've never put enough money in this state into preventative medicine.
Let's deal with future funding from Canberra, because that's the biggest threat to the state. Do you acknowledge, Minister, that this is still unresolved? When Barry O'Farrell signed that needs-based funding, activity-based funding with Julia Gillard, it's been abandoned and there's been no strategy to replace it.
Well, look, activity-based funding has been a major driver of the reforms and the improvements that we have made. We, for the next 2 years, have the tail end of that COAG Health Agreement, so we get increased funding from Canberra based on our increased treatments, but from the year 17-18, there are challenges, and Mike Baird has said that at the time that it was cut down. So we have to be smarter, and we're working with our doctors, nurses now, and health professionals to make it happen. I agree with John, it is the clinicians that are driving the reform and the change.
Federal funding?
Look, a tale of two ministers, Adrian Piccoli, who I'm critical on many issues, but when the federal government reneged on the Gonski deal, the National Education Reform Agreement, he went spare. He was in the public domain telling people how bad this was. I hate to say it, Minister, but we haven't heard the same battling for money for New South Wales hospitals with the federal government that Adrian Piccoli was prepared to engage in from you. I just want to say this.
Well, I invite
you now. I invite you now, Minister. Okay, I invite you now. I challenge you now, Minister. Say the same things about Peter Dutton that Adrian Piccoli has said about Pine.
Because, John, you'll know my style. I don't attack people, I attack issues. And my Premier and the Treasurer were very quick off the mark in saying that would be really difficult for New South Wales.
This dispute's been going on since May. There's no resolution.
Exactly.
After 2 years, there's no future growth in funding from the Feds.
Because it doesn't happen until the year 17-18. And can I tell you, we are working with the Feds, as you say, on coming up with some ways to provide alternatives to just putting a patient in a hospital bed. It's called integrated care, and I'm working very closely with Peter Dutton and all of the ministers across Australia on getting a much better arrangement of patients in the community, in primary health care, as well as in hospitals.
GP co-payment, $7, it's still on the federal agenda. Isn't it a good idea so that people have to make a contribution beyond the Medicare insurance levy?
It's a massive step away from a commitment to a comprehensive public health system. It's a step towards Americanisation. And look, I speak with personal experience. I lived in America. I saw healthcare in America. And it will discourage people from going to the GP. We want people to take graded responses to their health challenges. We want them to go to their GP. We don't want to create barriers. And for families that are operating right at the edge of financial sustainability, an additional $7, so a kid falls over, breaks their arm, $7 to go to the GP, $7 to get the x-ray, it mounts up.
Gillian Skinner, have you called on your party colleague Joe Hockey to abandon the $7 co-payment?
I've raised this at the Health Ministers' Council. I have said that we will look at it once it gets through the federal parliament. It hasn't gone through.
If it gets through.
Well, if it gets through, will it get through in the straight $7 co-pay?
But you don't want it. Let's be clear. We've got a state election here. Do you want this $7 co-pay?
No, and I have already written to the Health Minister about the impact on immunisation, for example. But also, I think, let's look at what might happen if it's moderated so that it excludes those on pensions, healthcare card holders, etc. Then that's a different scenario. I mean, I have never had bulk billing in my life. Many people don't. It is the people where it's going to have that impact, you know, those that might be exempted in a modified form that might be a different ballgame.
But Jillian, there are people who are operating their lives right on the edge of sustainability, who don't have health cards, who aren't pensioners, for whom this is going to be a disaster.
You need to look at the exemptions, I think, John.
John Kaye, do you acknowledge that the government has really enhanced the capital works programs and all the hospitals in New South Wales are being upgraded?
And about time too. Labor was appalling on this. They let the hospital system run down, and when Jillian became the minister, she started to fix that. But you can't run hospitals without nurses. You can't run hospitals without doctors. The real issue, and I come back to this again, the real issue here is securing our workforce and giving our workforce the number of nurses and the number of doctors they need.
On quality assurance, there's the nurse to patient ratio. Correct. 1 to 4, I think, is meant to be the benchmark, and you've not agreed to that.
No, it's called the nursing hours per patient day. That was what Labor agreed with the union, and which we supported and we have now implemented, so that we now have record numbers of nurses in New South Wales, 48,500.
And relentlessly increasing demand.
Relentlessly increasing. So that even Brett Holmes thinks we're doing a good job in that school. I should tell you, 1,400 extra doctors, over 200 extra paramedics, and I think about 1,000 extra support people in hospital. So you're right, John, they are the nub of it.
I want to challenge you on that, Minister, and we've been through this in budget estimates. That's a growth rate of nurses, a full-time equivalent of about 1.6% per annum. And that's almost the growth rate in New South Wales. And it doesn't take into account the fact that we are an ageing population. Yes, I acknowledge what Professor Duckett said, but we still do have an increasing demand on our hospitals. I'm not sure we're keeping up with it.
Well, I would argue that we are, that in fact a lot of our hospital patients are staying in hospital for a shorter length of stay. We would know that, so that the load on nurses is intense, I admit that to that, but we are implementing our nursing hour per patient day.
I'm sorry, Walt Secord from the opposition's not here, but on Monday the opposition attacked the government, saying the Australian Institute of Health and Welfare's latest report showed that New South Wales has the longest elective surgery waiting times in the country, average 49 days. Queensland performs best at 28 days. Minister, do you acknowledge this deficiency?
I think what Walt Secord is doing is playing with numbers. He's very good at spinning the numbers. What you've got to look at it is the number of patients in New South Wales is above the third of our population ratio. A large number of them are in Category 3, where the wait time is a year. So when you put it across the whole system, yeah, we've got more in that category, so it skews the numbers. When you look at it proportionately, we are the best in the country, both in elective and in emergency.
Well, you can say that, but the people who are on a waiting list to get their hip replaced, and I agree with you, we shouldn't play the numbers games. No, we should talk about the individuals who are waiting too long, and I think you'd agree with this, Minister. They're still waiting too long to get their hip replaced, to get their sciatic operation. We do need to do more to bring that down.
No, I would not agree with you. I really want to say I don't agree with you, because it is doctors that determine the clinical wait time. The categories, category 1, 2 and 3, are determined by doctors, not politicians.
Oh, that's unfair.
These are targets that were established nationally by doctors.
But no doctor wants to say to a patient who's in terrible pain with their hip, I'm sorry, you have to wait for 6 months.
No, they don't. It's on urgency category. If it's a hip that's causing pain, they can go to urgency 1.
Now, the Northern Beaches issue on so-called Americanisation with the PPP model, after the Port Macquarie disaster, determined by the then Auditor-General to be a financial disaster for the state, what's different about this Northern Beaches model?
When we announced the Northern Beaches model, I said we'd actually looked at Port Macquarie, learnt the lessons from it. We'd been to other jurisdictions, particularly Western Australia, where we actually learnt the lessons out of that.
Will you release the contract? So forget about commercial in confidence. Will you release the details of the contract so the public can see exactly what you're signing up for?
Well, those parts of it which are not commercial in confidence, I'm happy to make more transparent. That's been one of the things about the Baird government. It is about transparency. You'll see it soon, Quentin, because it's about to be released.
I know you deny Americanisation.
Absolutely.
John Kaye?
It is Americanisation. Right. You take the co-payment, you take the transfer of responsibility for public hospital services to the private sector, you introduce a profit motive into public health care.
Look, have a look at when it comes out, at what we're doing. And we spent a lot of time, and the lessons we learnt were spend the time in developing the request for tender, in developing the contractual arrangements, in negotiating with the parties what you're actually going to get and so on. And I can assure you, these will be public patients purchased, their services purchased by the state. There will be emergency department, ICU.
In perpetuity?
Yes, in perpetuity. In perpetuity.
They'll be dealt with by doctors who are being paid by a for-profit corporation. They'll be serviced in their beds by nurses who are being paid for in a for-profit corporation, with no chance whatsoever of getting nurse-patient ratios, which we know save lives. We're handing over...
We're doing this already, John. And the Labor government has been purchasing services from the private
Labor,
system
Jillian.
forever. But you should know that it's been happening.
I know it's been happening.
We get the policy difference. Jillian Skinner, John Kaye, thanks very much.
Thank you. Thanks, Quentin.